to OncoTrial Insights with Dr.Pidugu, the podcast where we explore the latest advancements in cancer research and treatment. I'm your host, Christine, and with me today is Dr. Pidugu. Today, we have some truly promising news to share regarding a significant development in lung cancer therapy. The FDA approval of Durvalumab, also known as Imfinzi, for adults with limited-stage small cell lung cancer, or LS-SCLC. Welcome, Dr. Pidugu.
Thank you for having me. Before we get started, I'd like to share a brief disclaimer. The views and opinions expressed on this channel are solely my own and do not represent those of any institution, organization, or employer. This content is for educational and informational purpose only and should not be considered medical advice. Always consult a qualified healthcare professional for medical guidance. The medical information on this site is provided as information only and is not to be used or relied on for any diagnostic or treatment purpose. Please consult your healthcare provider before making any healthcare decision. The contents and other forms of communication such as text, graphics, images, and other material created by this channel are for information purposes only. The information I will discuss is not meant to endorse or criticize any specific products or brands. My goal is to provide you with educational content, shedding light on various topics.
So let's dive right in.
That's right. This approval is a major step forward, and we're here to delve into what it means for patients and the oncology community. Our primary source for this discussion is a comprehensive article from the New England Journal of Medicine, a highly respected resource in the field of oncology. So, let's begin by establishing some context. Limited stage small cell lung cancer, or LS-SCLC, is a form of lung cancer where the disease is confined to one lung and potentially nearby lymph nodes. It's typically treated with a combination of chemotherapy and radiation therapy.
Exactly. While chemotherapy and radiation have been the standard treatment approach, outcomes for LS-SCLC patients have historically been challenging. This is where Durvalumab enters the picture. What makes this approval so significant?
Well, crucially, Durvalumab is the first immunotherapy to be approved for LS-SCLC patients who have not experienced disease progression following concurrent chemoradiotherapy. This is a game changer. For a long time, treatment options were quite limited for patients in this specific situation after their initial chemotherapy and radiation.
So, if we understand correctly, we're talking about patients who have completed their initial treatment. Their cancer hasn't spread, and this approval offers a new line of defense?
Precisely. It's about consolidating the benefits of the initial treatment and potentially preventing the cancer's return. You could think of it as providing a powerful boost to the body's immune system to help maintain control over the cancer.
That's an excellent way to put it. So let's talk about the clinical trial. What were the results that led to this important approval?
The approval was based on the ADR-IATC trial, a phase 3 study. This was a well-designed trial. It was a randomized, double-blind, placebo-controlled study considered the gold standard for clinical trials.
Okay, that's a rigorous approach.
It is. In this trial, 730 patients were randomly assigned to receive either Durvalumab or a placebo. Importantly, neither the patients nor their doctors knew which treatment was being administered, minimizing potential bias and allowing for a clear evaluation of the drug's effects.
That's a very robust study design. So, what did the results demonstrate? The article highlighted a significant difference in overall survival.
The results were indeed compelling. The data revealed that patients who received Durvalumab experienced a median overall survival that was 22.5 months longer than those who received the placebo.
That's a truly significant extension of life.
It is. When we talk about these numbers, we're talking about giving patients more valuable time.
Absolutely. What about progression-free survival? I imagine that was also a key metric.
Yes, progression free survival was also significantly improved. Patients receiving Durvalumab had a median progression free survival of 16.6 months compared to 9.2 months for those in the placebo group.
So, patients are not only living longer, but they're also experiencing more time without their disease progressing.
Exactly. It's about more quality time.
This drug, Durvalumab, appears to be making a substantial difference. The article mentioned that it's a type of immunotherapy. For those of us who aren't immersed in the science, can you explain how it works to combat cancer?
Certainly, Durvalumab belongs to a class of drugs known as immune checkpoint inhibitors. To understand how it works, we need to discuss how our immune system fights cancer. Our immune system is our body's defense system, constantly surveilling and identifying anything that doesn't belong, including cancer cells. However, cancer cells are adept at evading the immune system. They've developed mechanisms to switch off immune cells, preventing them from being attacked.
So, these checkpoint inhibitors essentially restore the immune system's ability to recognize and attack the cancer?
Precisely. They release the brakes on the immune response, enabling our bodies to fight the cancer more effectively.
I see. And Durvalumab specifically targets a protein called PDL1?
That's correct. PDL1 is often found on cancer cells. Durvalumab helps our immune cells recognize and attack those cancer cells.
So, in essence, it's like providing our immune system with an upgrade to enhance its cancer fighting capabilities.
That's an excellent analogy.
But as with any powerful treatment, I imagine there are potential side effects.
You're right. Like all medications, Durvalumab can have side effects. The most common ones mentioned in the article were pneumonitis, which is inflammation of the lungs, or radiation pneumonitis and fatigue.
Those sound like serious concerns. Should patients be worried?
They can be serious, which is why close monitoring of patients by their medical team is crucial. However, it's essential to weigh these potential side effects against the significant benefits of the treatment. For many patients with LS-SCLC, the opportunity for longer and healthier lives can outweigh the risks, especially when those side effects can be effectively managed.
So it's a matter of careful consideration and close communication between patients and their doctors.
Precisely.
Beyond the direct impact on patients, what does this FDA approval indicate about the future of LS-SCLC treatment and cancer treatment in general? What's the overall direction of the field?
This is undoubtedly a major step forward. This approval has the potential to establish a new standard of care for LS-SCLC patients who have completed chemoradiation without disease progression. For decades, progress in treating this specific type of lung cancer has been slow.
This is huge. So this could be the beginning of a new era for LS-SCLC treatment.
Absolutely. What's even more encouraging is that the success of Durvalumab could pave the way for increased immunotherapy research across other cancer types.
That's incredible.
We're talking about the potential for new treatments for cancers that have been notoriously difficult to treat.
The New England Journal of Medicine article quoted Dr. Suresh Sanan, who described this approval as a potential breakthrough for the disease.
And he's spot on.
It's remarkable to consider that we might be at a turning point in how we approach LS-SCLC.
It truly is, and it underscores the power of scientific innovation.
This isn't just about a single drug or a single type of cancer.
Exactly.
It represents a fundamental shift in our approach to cancer treatment.
It's about harnessing the power of our own immune systems.
Which opens up a vast range of possibilities.
Absolutely.
It's all incredibly exciting, but I'm curious, are there any downsides or limitations to this type of therapy?
That's a very important question. It's crucial to remember that no treatment is perfect. One key point is that The ADR IATIC trial focused on a very specific patient population.
Okay,
These were patients with the limited stage small cell lung cancer who had responded well to their initial chemotherapy and radiation. While the results are highly promising for this group, we can't automatically assume the same results for all LS-SCLC patients or other cancer types.
understood. It's important to remember that these findings are specific to that context.
Exactly. Further research is needed to determine how Durvalumab performs in other situations. Additionally, cost can be a significant barrier for some patients. Immunotherapy drugs tend to be expensive.
That's definitely a concern.
Ensuring that everyone who needs these treatments can access and afford them is a major challenge.
What about side effects? We discussed pneumonitis and fatigue earlier, but are there other potential side effects that patients and doctors should be aware of?
Yes, while the article mentions the most common side effects, it's important to recognize that immunotherapy can sometimes cause the immune system to overreact. This overreaction can lead to a range of other side effects.
I see. Can you give us some examples?
The side effects can affect various organs, including the skin, the gastrointestinal system, the liver, and even the endocrine system. While these are less common than pneumonitis or fatigue, they can occur.
So it's a balancing act. The goal is to stimulate the immune system enough to fight the cancer, but not so much that it starts attacking healthy tissues.
Exactly. It's a delicate balance.
This highlights the importance of personalized medicine, doesn't it?
Absolutely. What works effectively for one patient might not be the best approach for another. Managing side effects often requires a tailored strategy based on the individual patient's needs and medical history.
It's complex.
It is.
Good point. It's worth mentioning that while this approval is exciting, the long-term benefits and potential side effects will need continued monitoring through real-world data and post-marketing studies.
Absolutely. For clinicians, this approval offers a new treatment option that could prolong survival and improve patient outcomes. But as with all immunotherapies, careful patient selection and monitoring for immune related side effects is essential.
So what's next?
While ongoing trials are exploring combination therapies such as pairing Durvalumab with tremelimumab or other checkpoint inhibitors to further enhance the immune response. Other studies are investigating its role in earlier disease stages and in combination with the novel agents.
That's right. And we'll be keeping an eye on the emerging data to see how it shapes future treatment landscapes. Dr. Pidugu, thank you so much for sharing your expertise with us today. This is truly exciting news for patients with limited stage small cell lung cancer.
It was my pleasure.
Thanks for tuning in to this episode of OncoTrial Insights with Dr. Pidugu. If you found this discussion helpful, don't forget to subscribe and share. We'll be back soon with more updates on the latest in oncology research. Take care and stay informed. Until next time.